Hello, I'm Dr. Wally Bartfay, and in this lecture, we will examine human responses to disease, illness, and sickness. We will first begin by defining what exactly is a disease. The stages of the illness experience differentiate between the terms acute and chronic diseases, and also communicable and non-communicable diseases. Let's begin our learning adventure. So what is illness? Illness is defined as a subjective or psychological state experienced by an individual who feels aware of not being well or their experience with a disease. And it is a social construct fashioned out of transactions between healthcare professionals and affected individuals in the context of their common culture. Here you see the 5 stages of the illness process shown in this particular diagram. Individuals' acceptance of their clinical diagnosis and treatment regime or plan follows a relatively predictable and typical path through the so-called illness process. And we will examine each of these 5 stages in more details in subsequent slides. Stage 1 is of the illness process. So this actually begins when the individual notes that something is going wrong with them. They may experience abnormal signs and symptoms, for example. Some individuals may also engage in the process of self-diagnosis and treatment. For example, they may think that their stomach is a little bit upset due to acid reflux, so they may consume antacids to treat this acid reflux. They may also take acetaminophen to relieve a fever, a migraine or a headache, or pain noticed in the joints. What are symptoms? Well, symptoms are defined as those aspects of the illness that an individual actually experiences, feels, or perceives. There may be hypertension, shortness of breath on exertion, and pitting edema in lower extremities are examples of common symptoms associated with heart failure and circulatory problems. And here you can see a photo of a gentleman with severe pitting edema attributed to heart failure and circulatory problems in his lower extremities. Okay, so what are signs? Signs are defined as manifestations of an illness that an individual can actually see. For example, the bullseye rash on one's extremities, here in the photo on the right, you'll see it on the hands, may be associated with Lyme disease due to the black-legged tick. There could be pitting edema of the feet, again with heart failure, blood in the urine, maybe bladder cancer, or blood in the stool, bowel cancer. The state of perceived ill health varies, and it is dependent on the dominant social and cultural norms, traditions, and expectations they subscribe to. It also includes beliefs about the causation of illness, the level of stigma attached to each set of the symptoms, the prevalence of pathology, and meaning of illness to the individual and or family. Here you see a picture of the Indian goddess associated with cholera and smallpox. And again, depending on the dominant social and cultural norms, some of these ill states of health have different cultural interpretations. For example, in South America or in Mexico, in the southern regions, diarrhea is very, very common. However, here in North America, it is not so common, and it is often perceived in a much different state. Stage 2 of the illness process, signs and symptoms persist and do not diminish in severity over time, even with self-treatment. The individual decides that the illness is therefore serious and real. Acknowledgement that they now require some validation, advice, and or guidance from others. And it may be from a family member, it may be from a healthcare professional, or maybe even from a shaman. So here you see an example of cellulitis. This often worsens over time the condition if left untreated, and it can actually be life-threatening in certain instances as well. Permission granted to act and be sick. Well, this stage actually gives the individual permission to act and to become overtly sick according to their own cultural and social norms. They may be excused from normal obligations, such as work or school. It is notable that 3 out of 4 short-term work disability claims in Canada are related to mental health issues. Stage 3 of the illness process, the individual formally seeks professional advice and assistance for dealing with illness and to further legitimize the sick role. They visit their primary healthcare provider to be formally assessed, and this may entail some physical examinations, some blood work or other laboratory work and diagnostic tests, maybe ultrasounds and x-rays, etc. And the healthcare provider provides a preliminary diagnosis and or professional advice based on their physical exam and an assessment of these diagnostic tests conducted. Stage 4 of the illness process, the individual considers clinical diagnosis and professional advice and treatment regimes suggested to manage their illness. Now, each individual responds differently to a clinical diagnosis depending on their nature and severity of their illness or condition, and also in reference to their cultural expectations and norms. So that previous example I gave with diarrhea, for example, if you lived in South America, this is something that is relatively frequent and normal. They would probably resume or continue on with their normal activities of daily living. Here in North America or in parts of Europe where it is not so common, they would probably be withheld from going to work or school or other social obligations they may have. Individual responses. If the problem or condition is relatively simple in nature and non-life-threatening and easily treated, the individual typically accepts the diagnosis and treatment plan or regime. For example, if they've been diagnosed with having the common flu and they only require rest and drinking plenty of fluids and self-isolation, they're very likely to accept this particular treatment regime. By contrast, if the problem is deemed complex and potentially life-threatening in nature, and which requires more complicated treatments and or interventions, the individual may initially deny the diagnosis and or seek a second opinion. For example, stage 4 cancer, which may require surgery or radiation or chemotherapy. There may also be professional differences in opinion on how to best treat and clinically manage their noted disease or condition. Here you see a Foley catheter bag here with some gross hematuria, meaning blood in the urine. It is often a common finding associated with cancer of the bladder. Individual eventually relinquishes the sick role and works towards recovery and her rehabilitation or tertiary prevention during stage 5, or the last stage of the illness process. The shift now is towards restoring health, making them feel more comfortable, and or preventing further deterioration in their condition. For example, exercise and physiotherapy are common components of tertiary prevention, as we have learned in previous lectures. So what is sickness? Well, sickness is defined as a state of social dysfunction of an individual with a disease or the result of being defined by others in one's culture as unhealthy, and the expected role that the individuals should assume when ill. Here you see a photo of a gentleman with edema or swelling noted in the lower extremities due to circulatory issues, and also diabetes being present. What is the sick role? Well, this is defined as a behavioral pattern in which an individual accepts and readily adopts the signs and symptoms of a physical or mental disorder in order to receive care, seek sympathy, and or to be protected from the demands and stresses of life within their culture. What is a disease? Well, we define a disease as an interruption, cessation, or disorder, either mental or physical in nature, that may arise from a single or combination of factors, such as an infectious agent or determinant of health. Some examples here include parasites, viruses, genetic predisposition to certain diseases, a biochemical imbalance, certain lifestyle factors, or something in the environment that is characterized by a recognizable set of clinical signs and symptoms. Here on the right, you see a photo of a tapeworm in a jar. Adult tapeworms can actually measure more than 25 meters in length, or 80 feet, and they can survive in individuals for more than 30 years in a host. So there's various parasites which can affect humans. How are diseases typically classified? Well, there are various different ways of classifying diseases, but in general, they are classified into 5 categories, which are shown here: allergies and inflammatory disease, cancer, congenital and hereditary diseases, degenerative diseases, and metabolic diseases. And we'll explore these in greater detail in subsequent slides. So let's begin with allergies and inflammatory disease. Well, allergies are caused by the body's reaction to an invading foreign agent, substance, or allergen, which results in the development of antibodies. So here on the right, you see a photo I've taken of ragweed plant. Ragweed is very common cause of hay fever here in North America and in Europe, and its pollen can be carried for distances up to 200 kilometers away. Cancer is a collective term used to describe a group of diseases characterized by uncontrolled cell growth and division, or the loss of the cell to perform normal apoptosis. Apoptosis is programmed cell death. Stage 0 is carcinoma in situ. It is the early form. Stage 1, where it becomes localized. Stage 2 is early, locally advanced. Stage 3 is late, locally advanced. And stage 4 is what we call metastasized, or when it spreads to different regions or different tissues in the body. So the third type is called congenital and hereditary diseases. These are a group of diseases called by familiar genetic tendencies by which particular traits or conditions are genetically transmitted from parents to their offsprings. So for a congenital example we have here is an individual, little babies are born with these defects. Congenital heart disease is one. Or ones that may be inherited from your parents, such as sickle cell disease, Huntington's disease, Tay-Sachs, beta thalassemia major. These are examples here. Fourth is degenerative diseases, a disease or group of diseases characterized by the progressive deterioration of the structure of tissue, organ, or a body part over time, which eventually results in mental or physical alterations to function. Examples are included here are things like Alzheimer's disease, a form of dementia. There's over 100 forms of dementia, actually. Multiple sclerosis, arthritis, ALS or Lou Gehrig's disease, and Parkinson's disease. What are acute diseases? Well, these are defined as those disorders or conditions that are relatively severe in nature with a sudden onset but have a short duration of clinical signs and symptoms. So examples include things like heat stroke, chickenpox, pneumonia, and influenza. Here's a photo I snapped when I was in Japan, and it's warning individuals to be careful about the effects of heat stroke. What are chronic diseases? These ones are defined as those disorders or conditions which tend to be relatively less severe in nature, but are continuous in duration and which can last for long periods of time, including an entire lifetime. So examples include things like heart disease, stroke, COPD or chronic obstructive pulmonary disease, diabetes mellitus, cancer, schizophrenia, bipolar disorder. So schizophrenia is an example of a non-communicable chronic mental disease or illness, if you wish, that an individual has once diagnosed for the remainder of their lifetime. What is a non-communicable disease, abbreviated NCDs? Well, these are defined as diseases that cannot be transmitted from one individual to another or from a group to a population. Examples of these include cardiovascular disease, cancer, diabetes, COPD, bipolar disorder, and schizophrenia. We will explore non-communicable diseases in greater detail in subsequent mini lectures. Here you see a photo of a gentleman who's underwent a replacement of a pacemaker. He was receiving some anticoagulant agents, some Coumadin at the time, so you'll see some more than usual bleeding happening here and bruising. Heart disease is a chronic non-communicable disease. You cannot transmit it, in other words, from one person to another. What are communicable diseases? It's an illness caused by a specific agent or its toxic products that arise through the transmission of that agent or its product from an infected person, animal, or reservoir to a susceptible host, either directly or indirectly through an intermediate plant or animal host, vector, or the inanimate environment. So an example here will be influenza, of course also known as the flu or seasonal flu, and it is a preventable communicable disease where we can get our annual flu shots. Again, we will examine communicable diseases or infectious diseases, if you wish, in greater details in subsequent mini lectures. We also have a reportable or notifiable disease list. These are in Canada and in other countries like the United States and England and other nations around the world for that matter. These are determined by national and provincial or territory legislations here in Canada that decree which diseases will be reported and which public health agency is responsible for reporting them. The list of reportable diseases are mandated by provincial, territorial, or state legislation and may therefore slightly differ. This is often based on recommendations by the World Health Organizations, the Public Health Agency of Canada, Centers for Disease Control, or the Minister of Health and Long-Term Care in Ontario, Canada, for example, and are updated as required. For example, SARS, H1N1, Zika virus, and of course the new edition of COVID-19 as of 2019 pandemic. Here's an example of a reportable disease list based on from the Medical Officer of Health for the Durham region of Ontario, Canada. You can see things like rabies and typhoid fever, West Nile fever, hepatitis on there, meningitis, measles, etc. There's also non-reportable or notifiable diseases. These are typically regarded as communicable diseases that are common in populations, but the public burden of the disease to the community is not considered large or great in nature per se. Examples include the common cold, bedbug infestations, conjunctivitis, also known as pink eye, pediculosis, and scabies. So here's a photo I've taken on the right of an individual who had bed bugs bites located on the left foot and ankle region. Here's a suggested additional reading for you related to human responses to disease, illness, and sickness. Well, that's all, folks. Thanks for listening to this mini lecture, and I hope that you listen to others in this lecture series related to the art and science of public health. Cheers.